Hey guys, welcome back to my channel. Today we are discussing about the arterial supply of circle of Willis. Not in detail, but you guys will get the brief idea of that. First, just remember internal carotid artery and vertebral artery are the vessels that are going to supply the cerebral circulation. Internal carotid artery are shown here. I'm using green to mark it. These are internal carotid artery, and there are no branches of internal carotid artery until you get into the skull. Here you can see the some of the branches. We will discuss about it later in the next slide. And the vertebral arteries are shown here in the downside. Now we're coming into the definition of circle of Willis. It's an important junction of arteries at the base of the brain. The structure encircles the middle area of the brain, including stalk of the pituitary gland and other important structure. Now we'll discuss about the branches in the next slide. So here in the bottom side, it is what? Vertebral artery. I'm using short form VA. It actually comes from the subclavian artery, which we already discussed in the previous lecture. This vertebral artery runs through a hole. Suppose this is a hole. This hole is called transverse foramina of cervical vertebra. Now, vertebral artery moving to foramen magnum as they move up here. Suppose this is a foramen magnum. Okay, in both side. And now when vertebral artery moving up to foramen magnum, they give up two branches in the both side called posterior inferior cerebral artery. I am marking in blue this one, posterior inferior cerebral artery, in both side. Please remember it. It is also here, posterior inferior cerebellar artery. Now this posterior inferior cerebral artery gives another branch from here, that is posterior spinal artery. Now vertebral artery continues to move up and give up a branch here. I am indicating the branch in magenta color, and these guys fuse together, form an artery and moves towards the spinal cord. Here is a spinal cord. This guy is specifically called anterior spinal artery. What is the name of the artery? Anterior spinal artery. Okay, now you can see here vertebral artery. This is a vertebral artery. It comes together and fuse here and move up weak vessels right up here and form what? Basilar artery. Now we got our basilar artery. I'm writing here. And along basilar artery there is another branch right of here from both side here and here, that is called anterior inferior cerebellar artery. I'm using short form here, AICA, anterior inferior cerebellar artery. These two branches. Now you will see here some many branches here, 1, 2, 3, and 4. These all branches are called pontine branches. Pontine branches. Next, from pontine branches, we have another branch, and it's going to be called superior cerebral artery. Here you can see this one is your superior cerebellar artery in both sides, here and here. Next we have posterior cerebral artery. I'm using black to identify it. This one and this one, both, which is posterior cerebral artery. And there is a segment, there is two segment, that is P1 and P2. This one is P2 from here to here, and I'm using blue to identify P1, that is from here to here. This is called P1 and this is P2 in both sides. Please remember it. This is P2 and this is P1. This is a two segment of posterior cerebral artery. This posterior cerebral artery fills the posterior part of circle of Willis. It actually fills the posterior part of circle of Willis. Now, laterally branch coming from here is called posterior communicating artery. That is here. This one is posterior communicating arteries. Now, coming to our most important artery, which contributes to the circle of Willis about 60%, that is our internal carotid artery. This one and this one. These both are intercarotid artery. Internal carotid artery. Next, it gives a small branch, which is this one, this both branch, which is called ophthalmic artery. Now we can see a big branch here, this one. This is called middle cerebral artery. Middle cerebral artery, right? Now, just for the revise, this one is your what? Posterior communicating artery. This one is your internal carotid artery, and this one is your what? Middle cerebral artery. Now, some of the branches of middle cerebral artery. First one, that is anterior choroidal artery, that is here. I'm using black to identify it. This one and this one. This is anterior choroidal artery. Now coming to our last part of the circle of Willis, that is ICA, means internal carotid artery, gives its all to the circle of Willis. As you can see, the branch right all through the hair is called, just here, this one, this whole branch is called anterior cerebral artery, and it also has two segments like the previous artery, that is posterior cerebral artery, which has P1 and P2 segment, and it has A1. This one is A1 from here to here, and from here to here this one is A2. Please remember this both segment, just like here we have P2 and this one is P1 for posterior cerebral artery, and for anterior cerebral artery, as you can see here, A1 and A2. This is a little bit brief about circle of Willis and its the branches which contribute to make the circle of Willis. Now coming to our next part. Welcome to our next topic, that is on cranial fossa and its foramen. Cranium contains 3 fossa, and this is important in clinical imaging. First, you have to understand that cranium contains 3 fossa. First one, that is anterior fossa. I'm using red color to identify that anterior fossa. This whole region is anterior fossa. Next one, that is middle fossa, which extends from here to here, and the last one, that is posterior fossa. This is middle, and the last one, this one is posterior fossa. And we have another one, but this is not fossa, and this is a hole, that is foramen magnum. It's a big hole. We will discuss in another slide about this foramen. This is called foramen magnum, very important foramen. Now let's discuss about each fossa individually, about its openings. And first, so now we are talking about anterior cranial fossa. First structural feature to point out here is cribriform foramina. We will see here in the picture. This one, I am using red color to identify cribriform foramina here, and it is under anterior cranial fossa. As you can see, these are the borderline of anterior cranial fossa. What's the important of about this cribriform foramina? First of all, it's very small. As you can see in the picture, it's very small foramina, and they are going to transmit the axons of the olfactory neuron, that is your cranial number what first. Here it is written in the second point. Okay, and the third one, that is this neural axons will pass through this foramina and synapse in the olfactory bulb. And if you want to hear about its clinical importance, then when it gets fractured by accidentally, cupriform plate will get damaged, and if this occurs, point number one, that is you will feel loss of smell. Point number one. And point number second, that is you will have loss of CSF, which referred to as rhinorrhea. It means loss of fluid through your nose. We'll see in next slide. You will found there is a loss of fluid from here, from the nose. And loss of CSF, that is called rhino. Rhino means nose. If you study medical terminology, then you can easily understand about this. And you feel loss of smell. And last, you may have an infection. Infection also occurs due to fracture, and that could result in what? Meningitis. IDIS means, I told earlier in my lecture, that it's called inflammation in nose. I mean, irritation occurs. Okay. Now coming to our next cranial fossa, that is the middle one, and it has various openings or passageway. The first one will identify the optic canal. It is here, these two dots. I am using laser to identify it. These two dots. Now I am using green color to identify optic canal. This one, which transmit optic nerve, which is your second cranial nerve, CN2. And the second landmark, which is found, which is very important landmark in middle cranial fossa, that is sella turcica. I am using yellow to identify it. In this region, sella turcica is present. And you will see here, there is a depression. I'm using blue. This depression, the blue color region, this happens due to the presence of pituitary gland. Here actually pituitary gland exists. Now posterior aspect of sella turcica, that is called what? this one. To use, yes, this one. What is its name? This is called dorsum silly. Okay. Now the third one, that is superior orbital fissure. It is present here. It transmits various structure. First structure is cranial nerve 3, that is oculomotor nerve, and next one is cranial number 4, that is trochlear nerve, and third one, that is abducent nerve, that is cranial number 6. Remember, 3, 4 and 6 are from superior orbital fissure. Now the fourth structure, that is foramen rotundum. It transmits cranial nerve 5, that is trigeminal nerve. We will identify foramen rotundum here. This foramen, I am using blue to identify it. This foramen in both sides is foramen rotundum, FR. This would be V2, as also known as the maxillary division of trigeminal nerve. As you can see here, point is written. Now we're coming to our fifth foramen, that is foramen. Now coming to our fifth foramen, that is foramen oval. This structure transmits the third and final division of trigeminal nerve, as you can see in the slide, and this referred to as mandibular division. Can you identify foramen oval? It is here, just, and it's looks also round, so that you can identify it. And this one is foramen rotundum, and this one is foramen oval. I don't know where foramen rotundum is missing here in this picture, but anyway. And this foramen transmit the trigeminal nerve. Just remember it. I am using green to make it highlight. Now the sixth one, that is foramen lacerum, which is present where? Can you guess? Which is present here. Here is your foramen lacerum in both sides, here and here, and it transmits what? Deep petrosal nerve and meningeus artery branches. These two. Now we coming to our next and the last, that is last part of medial cranial fossa, that is foramen spinosum. It is here. Here is your foramen spinosum. So you can remember, here is your foramen rotundum. This is foramen oval, this one, and this is foramen spinosum. And this black one here in green color, this is foramen lacerum. Now coming to our point, that is foramen spinosum, which transmit medial meningeal artery. As you can see here, it transmits medial meningeal artery, and it is present in both sides. As you can see, I am using red to identify in another side. These both are present in both the hemisphere, and this transmit what? Meningeal artery. Now coming to our third and final fossa, that is posterior cranial fossa. Its openings are internal acoustic meatus, jugular foramen, hyperglossal canal, and foramen magnum. First one, that is internal acoustic meatus, which is present where? Can you guess? Here it is present, internal acoustic meatus. Here, this one is your internal acoustic meatus. Next one, that is jugular foramen, which is present here. Sorry, I am using both the same color. This one is your jugular foramen. Third one, that is hyperglossal canal. You can't see here hyperglossal canal, but I am trying to make the ideal location of hyperglossal canal. It is here, just beside the foramen magnum, in the lateral side. And the last one, that is very important, that is called foramen magnum, and it's very easy to identify. The big hole here is foramen magnum, and beside this it's the hypoglossal canal, and this one is jugular foramen, and this one is internal acoustic meatus. Now we'll discuss about their transmission of artery or nerve. First one, that is internal acoustic meatus, which transmit facial nerve, that is cranial number 7, and the second one, that is cranial number 8. One is missing. This one is cranial number 8, which is vestibular cochlear nerve. And jugular foramen transmit cranial number 9, cranial number 10, which is vagus nerve, and the cranial number 11. And last, that is hypoglossal canal, which transmit cranial number 12. Now coming to our main foramen, that is our foramen magnum, which is here, which transmit cranial number 11. And first it transmit cranial number 11, second is vertebral and anterior posterior spinal arteries, third one, very important, medulla oblongata, and the fourth one, which is spinal cord itself. So here in foramen magnum, I am ending my lecture of this presentation. Next lecture we'll discuss about the inferior view of skull and the anterior view and their openings. Thank you for watching. Please like and subscribe for more videos.